Hi, this is Raza Khan, and I would like to share my knowledge on the topic of the impact of surgical pathway WHO surgical safety checklist and its impact on patient safety. I conducted this study in two tertiary healthcare center of Karachi. What is WHO patient safety surgical checklist? It is a checklist, a standard points of practice which is essential before every surgery. These points should be checked before every surgery, either it is minor, major, or any kind of surgery. These points are essential. So how this checklist was developed and what is the necessity of this checklist, to understand that in 2007, WHO reviewed the surgical mortalities, the mortality and morbidity in operating room services. After they reviewing the data, it was identified that a greater number of errors, a greater number of mortalities and morbidities are related to practices, like sometimes equipment is non-functional, sometimes surgeon is not available, sometimes specimen is properly not labeled, sometimes swab or needles uh, left inside the surgical cavity. This incidence was very common. So they picked the idea from the aviation industry. In the aviation industry, pilots were using a checklist to standardize their processes, their uh, their procedures, how to record all these things, and what should be the way for the recording that. So they developed a checklist on which were essential for every pilot before flying off the plane, and that was to check the engine, to check the performance, to get the clarity for the maintenance team, from the all relevant stakeholders, and all SOP points should be uh, complied. So on this impact, it was identified. This checklist portray a great impact, a greater satisfaction industry, a less number of incident in the uh, aviation industry. So after successful impact of such surgical checklist, WHO adopted this idea to develop a checklist in healthcare industry before every surgery, before every procedure, to to minimize the risk of error, the risk of such avoidable incidences in the surgical, to ensure the patient safety. Before that, before that, uh, at that time, we are facing multiple challenges worldwide in healthcare industry, like the poverty issue, the infection issues, the communicable disease issue. But along these all incidents, there is a larger number of incidents which can be prevented due to of standardizing our procedures. So, before the conducting surgery, I faced multiple issues, and one of the issues was in Pakistan, in African countries, there is no such recording of data. There is no such practices which record the procedures. So I conducted this study for a period of 6 months, 2 months before the implementation and 4 months after the intervention of this. And there was the people was reluctant to change, and my motto and aim was only to improve the practices. how to improve the practices and how to we can optimize the patient care in operating room services. So this is actually you can see this is the first edition of surgical checklist. This is divided into three parts. The first part is sign in. The second one is a timeout, and the third one is timeout. In the sign in part, there was steps related to the patient identification, the patient before the steps which involve to ensure the safety and the patient identity for the surgery to avoid the chances of error like the patient identity, the patient equipments, all these. Like it has component that the patient has confirmed the identity, surgical site, surgical procedure, concern, has concern, valid concern, and it has also point that if the site mark is applicable, it is marked or not. It has also the component anesthesia, equipments, all safety check things are functioning or not. It has a component like equipments, like anesthesia machine, like pulse oximeter, like all or essential equipments which are required for the surgery are fulfilled or not. It has a part in which surgeon and anesthetist ask, the OR team member ask, is there any critical step they are anticipating during the surgery? If yes, then they arrange a proper arrangement to deal such a challenge or not. If not, then they cannot proceed. They cannot intubate the patient for the procedure. Like if you are replacing a spleen, or so you have such large number of whole bloods, if you are dealing a trauma surgery, and so you have the arranged number of bloods, or if you are doing an orthopedic surgery, so you have the implants available, implants are properly sterilized or not, so you can customize this step according to your requirement. The second the second part, the timeout is very crucial part. It is after the intubation and before the starting of the surgery. Like all team members confirm their identity to ensure that all the relevant stakeholders, all the relevant team members are present in the OR. Surgeon anesthesia professional confirms the patient name to cross-check that the correct patient are going to be operated. The patient site is confirmed, the patient procedure is confirmed. They discuss all anticipated critical events during the surgery, like blood loss, like placement of implant, or other thing which is necessary. Like if you are sending a frozen section, so that your conversation should be communicated to the relevant pathologist for the frozen section, or all such like thing which can pose a delay or pose a chances of cancellation of surgery after the intubation. So all these steps are ensured in this. And it has also that before the starting of the surgery, antibiotic prophylaxis has been given to the patient to minimize the risk of infection, hospital, and the required essential imaging like MRI, ultrasound are um, is displayed or not. Like in Pakistan, we face multiple issues that a patient is going to be operated for the tumor surgery, but on the basis of which the MRI, the brain MRI, like or the spine MRI or the bone MRI is not available. So on how you can remove the correct tumor or correct organ if you are operating the patient for appendectomy and you have no ultrasound, no evidence to open the abdomen, then such you can, this is a critical issue. Healthcare Commission can ask, court can ask or pose a fine on you. So this, and the final step, that is a sign out, which is at the end of surgery. It is to ensure that all plan, all procedures or all things are carried out as per the plan. Like nurse verbally confirmed with the patient that the procedure, which is like if the planned procedure and the performed procedure same or not. If there is change, then the change should be documented. And another instrument swab count is correct to ensure that no instrument or swab or anything are placed in or left in abdominal or incisional cavity. And at the end, if they are sending any specimen or if they are proceeding performing a diagnostic surgery, so the specimen should be sent for the surgery. Uh, and they also discuss the events, the steps of the surgery to ensure that if there is any lapse, to ensure that such lapse should not be carried forward in next procedure. This is the updated version, which has few amendments, and you can customize this as per your requirement. So before that, what was in my methodology for this study? I conducted this surgery study in two tertiary care hospital that was approx 800 bedded hospital, and there was around 1,000 plus cases per month. So and after the changing, I I examine the impact of this surgical safety checklist on the patient, that due to the implementation of the surgical checklist, the number of chances of error reduced dramatically. The surgical cancellation, the surgical uh, delay in surgery was reduced amazingly. Uh, like in the first month, in the month of Feb, the cancellation ratio was decreased by 6%, and then uh, dramatically raised in the next month. This is the graph showing the record after the implementation. Like 2% or 3% chances of error reduced. The cancellation was reduced, the cancellation and this was reduced by the 6-7%. So that was the reason. In the first month, 12% delay in cancellation was reduced, and in the second month, 6, and gradually it was reduced to the 0%, minimal percent. So I would like, at the end, in the conclusion, I'd like to discuss such uh, steps should be followed in each and every hospital to ensure the patient safety, and such checklist should be developed at the ward and or like 6 hours before the surgery, or 12 hours before the surgery, to ensure all the unnecessary arrangement are made for the patient. And finally, before bringing the patient in a OR or taking it in for the anesthesia, this checklist should be followed to enhance patient safety, and to ultimately to increase the patient satisfaction. Because if you cancel a surgery due to non-arrangement of equipment, or after anesthetizing the patient, if you cancel the surgery, then it has a great negative impact on the patient satisfaction, because the patient attendant patient was expecting that the surgery, which was solution, ultimately solution for their health, will be carried out. But after awaking, the patient knows that, oh, my surgery got cancelled due to non-availability of implant, or due to non-availability of the surgeon or anesthetist, or like something like that. So such issues should be avoided. I would recommend that such intervention should be carried in, especially in the developing countries, low middle income countries, and uh, it is for the development, this hospital management, the OR management, the nursing team, the doctor clinician should be on the taking on the board for the successful implementation of this process. And this checklist will also help to for the implementation of the resource management. Like if you have low capacity and you are planning a large number of surgeries, or you are putting a surgery which have no arrangement made for the surgery, then it will be difficult for you to manage as an OR professional. So thank you. If you have any question, you can ask me directly on my email, razaphd87 at gmail.com. Thank you.